Duties of general pediatrician and gerontological aspects in pediatrics. These responsibilities of general pediatrician include the following: caring of therapeutic and preventive work among population, diagnosis, treatment, and prevention of disease, providing emergency care and pre-hospital and hospital stage, diagnosing disease and collaborating with other specialists, performing practical skills, paying attention to deontological issues, working with educational and scientific literature, conducting scientific research work. Doctors. As you know, in our country, doctors named chief of corps, and it means SH stands for sweet spoken, enthusiastic, and compassionate. I stands for knowledge, willpower, progressiveness, and humanism. F stands for dedication and presence. O stands for courage, wisdom, and nobility. K stands for modesty. O stands for cleanliness and neatness. R stands for honesty, kindness, and systemic approach to work. What is medical ethics? Medical ethics is the science of a doctor's conduct in professional activity and their behavior in an interaction. Medical deontology is a part of medical ethics. It deals with the duties and responsibilities of a doctor, the doctor-patient relationships between doctors and medical staff, and communication with the patient's family and the general public. According to Burmese children's reaction to hospitalization are classified in two groups. First, children who are irritable to actions, cry easily, have sleep disorders, and do not play with toys, show strong negative reaction to hospitalization. Next group, children who remain calm and soft-natured when hospitalized. And third group, children with difficult personalities who react positively to hospitalization. My department's the doctor first receives information about the child and their patient at the admission department. As the famous actor Stanislavski once said, theater begins with the cloakroom. We could similarly say a hospital begins with the admission department. If the admissions is cozy and clean with colorful toys, pictures, and beautiful aquariums, it can positively influence the children's attitude towards hospitalization. Example of an insensitive doctor interaction. A removed doctor from St. Petersburg, Spassky, was called to a critically ill patient. The patient asked him weakly, "Doctor, tell me honestly, is there any hope for recovery?" Spassky replied, "Not at all. Pushkin is dying, so you too can die with us." The patient threw himself on his pillow and died the same day, despite being considered one of the best doctors of his time. Spassky showed a lack of empathy and warmth. Another example, an elderly man came complaining of weakness, headaches, and fatigue in his legs. The doctor asked, "How old are you?" He answered, 75. The doctor replied, "The average life expectancy is 73. What more do you expect? These are signs of aging." In conversation with sick children and their parents, it is not appropriate to analyze or criticize the mistakes of other doctors, even if they were wrong. Doing so never breaks glory or respect. An incident in front of medical students who performed the surgery. The doctor should have his hands cure of this. The patient wanted to say something, but the doctor continued, "Look at these scars, but chaired like a butcher." When finally allowed to speak, the patient calmly said, "Doctor, you performed that surgery several years ago." This is an example of a doctor trying to elevate himself at the expense and another reputation right in front of the patient. Iatrogenia twins refers to harm caused by a doctor's words or action affecting to mental state or worsening the patient's condition. Iatrogenia may cause emotional trauma, exacerbation of chronic illness, manifestation of previously hidden disease. It's not only about inappropriate words, but also incorrect prescription, especially of strong or hormonal medication. In pediatrics, improper use of such drugs can cause ulcers or disease like Cushing syndromes. Another co-heterogenic condition, a throughless answer to a child's or patient question can have a negative impact. For example, a teenage boy recovering from dramatic cardiac asks if can return to wrestling. The doctor replies, rheumatism is a long and serious disease. I think you will have to give up wrestling forever. Such a statement can devastate the child, damaging their hope and trust in recovery. A better response would be, rheumatism is a treatable condition with proper diet and medication. I'm sure you will recover and return to the sport your life. Famous doctor and teacher Professor Vochel shares his experience. While examining patients, an assistant showed him a patient being discharged after myocardial infection. Vochel said, do not discharge him. I don't like the sound of his heart. The patient stayed hot. Another infection that later the neighboring patient said, when I heard you didn't like my heart tones, I knew my end was near. Night and died. Professor Vochel was deeply disturbed and wrote, I could not forget this incident for 10 years. It reminds me how carefully we must choose our words in front of patients. Thank you for your attention.